All right, so first an introduction. My name is Dr. Kevin Connors. I've been practicing since, 1986. Started out as a chiropractor practicing down in Stillwater, Minnesota was my first, or down in Woodbury, then Stillwater. And I practiced kinesiology and nutrition since then. Left to do some missionary work for a period of time, came back and started seeing more Lyme and cancer patients. Anybody has been on our website? Yes? Seriously? Only a couple people? So I'd suggest you do so because you can download our books. This is our most popular book, Stop Fighting Cancer and Start Treating the Cause. Our Lyme book is a free download on our website too. On that little flyer that you got here, that's what the Lyme book looks like. You'll see it a zillion times in the slides today. So that's, if you go on the website, you can click on it, download it as a free PDF download. Also, my book on, it's called You're Crazy, and then the subtitle is And Other Things. What is the subtitle? Let me remember my own book now. And Other Crazy Things Doctors Tell People Who Need Brain Therapy. So that's our whole book on understanding the brain, understanding what inflammation does to the brain. So if you have Lyme, you probably have some brain-based issues. That book would also greatly help you. There's also another book. I didn't bring up any copies of it because we're out of them right now. It's called Help, Your Body's Killing Me. That's a book on autoimmune diseases. That's what we're really going to hit tonight when we talk about Lyme disease. And that will be also very helpful. That's a shorter read book. So I suggest you download those. They're all free. You can also order them on Amazon if you like a hard copy. And we have some copies here. So we hope you have some time for questions afterwards. We have a lot to go over. So who here has Lyme disease? Okay, who here has a friend that has Lyme disease? Who here wants to have Lyme disease? One hand in the back there. That's good. So, chronic Lyme disease is something that is dear to my heart because I had Lyme twice. Never went into the chronic phase. My daughter has chronic Lyme that did go into the chronic phase. The doctor that works with me, this Dr. Kelly Hallerman, maybe some of you may know her because she lived up here for a period of time. She had chronic Lyme that went to the chronic phase, to the autoimmune phase, which we're going to talk about. And I'm going to give you a distinction there. There's a difference there in my book about that. And she was on her deathbed. Matter of fact, she had last rites given to her. So she was very sick. Now she works full-time with me. So there is, like Jane said, stories of great hope. We've had patients come into our office in wheelchairs and aren't in wheelchairs anymore. So, but it is a process. I'm going to say something that is not going to be probably well received to a chronic Lyme patient, but it is true. Chronic Lyme patients are more difficult to take care of than our stage 4 cancer patients. That's just the way it is, because a stage 4 cancer patient is either, they get better kind of on a linear scale. So they're either going to get better or they're not going to get better. There's kind of no in between. A chronic Lyme patient gets better like this. Okay? If you have chronic Lyme, you know what it's like. Some days you think, wow, I think I'm doing much better. I got this beat. And then the next day, you can't get out of bed. So it's very discouraging. And that's part of the debilitating part of chronic Lyme is that the discouragement can just be overwhelming. A little bit more about my background. I went back to school a number of years ago and I got a degree in functional medicine and an AMA degree in integrative cancer therapy. I don't do any chiropractic anymore. That's all we deal with now is cancer patients and chronic Lyme patients. And then Dr. Hallerman is a functional neurologist, MD, and she deals a lot with the brain-based aspect. We do neurofeedback in our office and a lot of home brain-based therapy issues. About 75% of our patients come from out of state or out of the country. They fly in, spend a week with us, and we get them started on a program.